Recording. Thank you to whoever prompted me on that one. Um, Recording started. There we go. So retrofit, as I was just saying, encapsulates basically any improvements that we might make to a building, such as insulation, a new heating system, solar panels. So we have between us a lot of expertise around that, and Harry specifically on domestic energy advice as well. So we're coming from I guess a technical area of expertise on this subject, to hopefully give you some useful pointers, and also talk a bit about some wider offerings of advice we're able to provide you on a bespoke basis, which we'll talk about at the end of the session. Um, and yeah, just I guess yeah, very briefly from what I've already said about March Energy Agency. So we're an independent charity based in the Midlands. We have offices in Shrewsbury and also in Derbyshire, and yeah, been operating for nearly 3 decades now across the Midlands, providing energy advice, predominantly to householders, but also to businesses, community organisations, community groups, and people like yourselves. Um, and a key part of this that we see is the overlap between energy advice, people living in cold homes, and the impacts on health, which is obviously what's going to be most important for you all. And from our experience, over 40% of householders we support report to be suffering for some kind of long-term health condition, such as asthma, COPD, and other respiratory illnesses. So there's now more and more evidence coming out that there is a clear link between those that either live or work in environments that don't have a good kind of thermal comfort level, or don't have good air quality, internal air quality. It has a negative impact on health. But I won't speak too much on that because I think I'll be preaching to the choir, as I'm sure all of you will know far more about that than either of us will. But we see this as a key issue, and we want to be able to support you in creating a happy and healthy environment, for your staff and for your patients as well. So, why is this important to the NHS more broadly? So, as well as comfort, bill savings, and things like this, it's also around reducing carbon emissions. And this is ultimately why Katrina at Greener Practice CIC have brought us in. They're really focused on decarbonising the primary care sector. And in terms of the NHS's carbon footprints, 20% of that is made up from the activities of the primary care sector. So you guys make a significant proportion of that total carbon footprint, and therefore there's a lot that can be done, a lot that you're able to control and take action on, which provides you with a lot of opportunities to yeah, play your role in that wider piece of decarbonising the NHS. And in terms of the kind of wider look of the UK, the NHS makes up to 45% of the UK's total carbon emissions. So, as an organisation or a collective of organisations and partnerships, the NHS is actually quite a significant proportion of this country's emissions, and therefore we need to collectively take action, and we want to be able to support you and give you the right advice so that you can do that effectively. And yeah, it's been a real pleasure to be able to partner with Greener Practice. You'll see their website URL at the bottom there, and they've got loads of really helpful resources, and they've done other webinars and sessions in the past. So do go check them out and find out some more information if you're not so familiar with Greener Practice. Okay, well, without further ado, I'm going to pass on to Harry, our non-domestic expert, who's going to give a bit more advice on some of the quick wins when it comes to energy efficiency that you may want to consider within your surgery. Over to you, Harry.
Hi everyone, and thank you again for coming. So yeah, as Ben's just outlined, I'm going to go through some quick and easy things that you'll be able to implement in your practices, that could help you save money on your energy bills, reduce that usage, and reduce your emissions as well. So I think if we click on to the next slide. So the first one and the easiest one is meter readings. Quite often you'll see on your energy bills, and this can be at home as well as your practice, there might be a little E where your consumption's listed. That means it's estimated and that your suppliers are making calculated guesses essentially on how much energy you're using. This can quite regularly lead to you being overcharged for energy that you're not using. So the easiest way around this is to submit meter readings to your energy supplier. at least monthly, if not more regularly than that. Equally, you can request that your supplier will install a smart meter in your practice, which will automatically send them meter readings and make sure that you're only paying for energy that you're using. And the next one, particularly in older buildings, draft proofing is really vital and can be a huge contributor to heat loss, and equally cold air coming in from the outside as well. So this is specifically small gaps in the building fabric. So whether that be gaps around the doors, windows, suspended timber floors, they can really cause a huge effect on the heat loss and make it a less comfortable environment. Ways that you can go about identifying this is a thermal imaging survey. So you can see where the cold gaps are in the building fabric and identify where you're losing heat and what kind of measures you can take to rectify that, which we'll come into on the next slide. Okay, so yeah, quick wins for air tightness and insulation, which will reduce the draftiness of the building. For external doors, you can just get a draft excluder that goes along the bottom of the door. These are cheap, affordable, easily available, and do have a real impact on that draftiness. Ideally, though, you'd look to repair seals on the doors and windows and just make sure they're airtight. I know, for example, in my house, I've got a very old wooden front door. And you can really feel it now. The evenings and mornings are getting colder. When you sat in the living room, you can feel the cold air coming in from there. Those of you who've got a fireplace or open flues, you can get a chimney balloon to go up there, just to stop you losing all the heat up the chimney, which nobody wants. And similarly to seals on doors and windows, you can use the builder's cork around the window and door frames to create a more permanent seal. And also loft insulation is fantastic. It's cheap, it has a real effect, and it's reasonably easy to do as well. So if you're looking to take a bit more of a permanent approach to air tightness and insulation, loft insulation is a great place to start. A huge outlay on electricity for most buildings, specifically those who don't use electric heating systems, is lighting. Most probably the highest that you'll have from electricity is from lighting. And if you're using the old compact fluorescent strip lighting, or even worse, the halogen or tungsten bulbs, there are real savings that you can make by upgrading to LEDs. In comparison with a compact fluorescent bulb, which was the standard maybe 10-15 years ago now, they were being put in, and now we've changed more to LED. LEDs are cheaper. They also last up to 4 times as long, which means you're not going through all the hassle of replacing the bulbs as often as you do at the moment. And they also do produce a better quality of light. It's a fantastic, easy and affordable way to really reduce your energy bills. Controls, they're vital. I think we've all had it at the end of a long day where you're leaving the office, or it might be a Friday afternoon and you need to get away for the weekend. You're thinking, oh, let's get everything turned off, or let's just leave now. I want to go home. It's very easy to just forget, oh no, I need to switch that off, and you get halfway home and maybe you realise, but you think, oh, it's the weekend now, oh well. There's a lot of measures you can take and steps you can take to make sure that doesn't happen, or just make it much easier. So occupancy sensors for lighting, that's where you walk in a room, the light turns off, you walk out, the light turns off. There is no opportunity for human error with that, which always helps. You can get kill switches for your sockets, which can be remote controlled. So say you've got an extension cable coming out of one socket, you can just press an off switch on your remote control on your desk when you leave, and that will turn everything off. There's no standby lighting that you're paying for over the evening or the weekend, which in reality you don't need to do. And you can come in the morning, press your on switch, and it's all back on again, and you're not needlessly paying for that electricity over the weekend. Heating controls also. I think we've probably all got experience in older buildings where you've got to go and manually turn the heating on yourself and program it with an old complicated programming system, or your radiator valves, you've got to go and twist all those to turn it on and off, and it's a bit of a hassle and makes it much harder. And a lot more effort to control your heating and keep that down. Nowadays, you can get smart heating controls, or just much easier to program heating controls that you can control off your phone, or a little panel on your wall, which is much more user friendly. Specifically for the newer heating system, these can be fantastic and give you a lot more control over when your heating's on and how much you're spending on it. And now we come to the energy efficient appliances. In the GP practice, we fully appreciate that you need to have certain things like fridges for medicines or samples, and they need to be on all the time. Printers and computers for your work. It's really important that these appliances are as energy efficient and up to date as possible on that, so you're not wasting money needlessly on running these when you can get better models. For fridges, it can really help to just clean down the back of them quite regularly, make sure it's not all cluttered and that the air can move freely and the fridge isn't working harder than it needs to do. That can extend the lifespan of the fridge as well as save money on running it. Printers and PCs, the newer models are going to be much more energy efficient, and with printers, there are organisations out there who can help with this, and you can lease printers, for example, from them, and make sure you're not spending a load of money on powering up a very old printer which prints about one sheet of paper a minute and takes you a load of time to get stuff printed out. Most of the time now, if you're purchasing a new appliance, there does tend to be an energy efficiency rating on the packaging. So it's worth just keeping an eye out for that and seeing, what you're looking at, and how efficient you can really make your office and practice. So I think that comes to the end of our quick wins now. So I'm going to pass back over to talk about what support there is out there at the moment for you as GP practices.
Thanks for that, Harry. That was really useful and a good summary. If there are any questions that have come up from some of that content, do feel free to put some questions in the chat, and we can come to them at the end of the session. If there's time, we'll do our best to get through them. Just I guess a small add-on. In terms of available funding currently from central government, the UK government has currently got the boiler upgrade scheme running, and we had to check this quite recently actually, because we thought it was just for homeowners, but it seems that businesses can also access this grant as well, which is really fantastic. And these grants are up to £7,500 off getting a heat pump system to replace a fossil fuel system. So say you have like a gas boiler or an oil boiler, for example, currently heating your practice, and you want to switch over to a heat pump, which will be using far less carbon, and it works incredibly efficiently despite the price of electric obviously being far more than gas. They're 4 times more efficient typically than, say, a gas boiler. So you could potentially either be saving money or not paying any more, and actually get a grant to make that switch to massively decarbonize your practice. It's probably the fastest way you can decarbonize if that's your motivation. So yeah, do keep that in mind, that the boiler upgrade scheme, and have a look on that online. You'll find a .gov website web page that gives you a bit more detail around that. So worth considering if you're thinking of going onto a heat pump. So that was obviously a very quick run through of some quick wins, and some of you may be looking at that, taking notes, thinking, okay, yeah, I can go away, I can do that myself. Some of you may be thinking, okay, that all sounds great, but I don't have the time to do more research, or it still feels really daunting, or I don't know where to start, and what are the priorities for my particular practice. Or maybe you're ready to go beyond the quick wins and you want to take some more substantial measures to decarbonize, to improve the energy efficiency of your practice, and really go for it. And that's why we're ultimately here, and why we've partnered with Greener Practice CIC. We want to be able to share our expertise and advice to give you bespoke information and recommendations as to how you can improve the efficiency and reduce the energy usage within your practice. And then there's a lot of benefits for you as to why you might want to do this. A big one, which we know is going to be so key for all of you, is reducing your practice overheads. You may find that your energy bills make up a significant proportion of your kind of on costs in running your practice. So the idea of being able to reduce that on a monthly and an annual basis is, I'm sure, only going to feel like a positive thing to save on those costs when you're already so stretched with your current budgets. So being able to make these interventions could ultimately be saving you money in the long run, even if there's an initial investment. We'll look at trying to find recommendations that give a suitable payback periods that in, over a few years, you'd actually start to see that money paid back and then just see savings from the energy usage and the energy bills that you were paying previously. So that is a potentially real positive benefit for you. Obviously, being able to decarbonize your practice if you're motivated by, concerns around climate change and wanting to decarbonize and do your bit, then we'll be able to give you advice as to the best ways to go about that, and also contributing to CQC's environmental sustainability guidance. I know where CQC can be pretty hot on your heels at times. I don't know if anyone's having to, go up for compliance, having their CQC officer come around and pay a visit. But if you really want to get in their good books, then this could be a really great way to do that, to take a proactive step in looking at how to improve the sustainability of your practice, to yeah, tick off that well-led section of your CQC compliance. And also part of the advice is we're wanting to give is to look at overheating issues as well. We're aware that that can be a problem for many, and you'll have loads of individual fans running on every desk to try and keep cool in the summertime. So we want to be able to give advice on how to more efficiently keep your building cool in the summer as well as warm in the winter. Um, and ultimately, we are motivated by improving quality of life for patients, for homeowners, householders, and ensure people can live in their home with dignity, and that extends to the time that they might spend at the practice to be able to be in a warm, comfortable environment when they're sitting in a waiting room, waiting to be seen. Through the advice that we give, there'll be the opportunity to improve the thermal comfort and internal air quality of your practice to improve that for your patients as well as for your staff as well. And a final note on there is just about the Green Impact for Health toolkit, which some of you may be aware of. It's not something that we've set up, but we're aware it's a particular scheme that's there that practices use to measure and attempt to improve their green credentials and their sustainability. And doing something like this would be able to contribute positively to that and help with you achieving whatever kind of award or level you're trying to achieve with that if you're embarking on using that toolkit. So yeah, so there's a lot of kind of benefits to this. And the cost of an audit. So an audit being a visit that we would do to your practice. So Harry would come down, spend some time with you at a time that was convenient. Say it might be over a lunchtime when the clinical rooms are available to come and do an assessment. He would collect a lot of information and data around your practice, and particularly the building, and then compile that information into a report and summarising the recommendations. And there'll be obviously there for discussion, and how are we there to help you and make sure that all the recommendations and advice are bespoke to you, what your needs and aspirations are. So we're offering this as a paid for service at the moment, and we've kind of broken it down as kind of a sliding scale depending on kind of the size of practice that you are, as a way to try and make this as accessible for you as possible, whether you're a really small practice in a rural area or almost small hospital. You might be in a more urban area. So this is kind of the price breakdown on there, and 20% of that fee goes to Greener Practice CIC to support they're furthering their mission in decarbonising the primary care sector across the UK. So yeah, it's also going to a good cause and then funds. And like I outlined earlier, the idea is that initial investment into it's all of them recommendations and getting this advice will ultimately pay you back in the long run through the savings that you'd make in your energy bills. So hopefully it would be seen as a valuable investment for you and for your practice. I wanted to wrap that up with just a couple of case studies just to outline the benefits of this and what this has actually looked like in the real world, so you don't just feel like this is some kind of pipe dream. So firstly, just a quick kind of celebration of CEP. They're a similar organisation to us that operates in Cornwall that did a pilot of similar audits to this, of auditing GP practices around Cornwall. And this was a kind of small infographic that they created to summarize the findings from doing 24 audits across that region. And it was really quite amazing to see, and I think really illustrates the benefits that the practices were able to see. So in total, across them 24 practices, there was £88,000 of immediate savings. So if you average that out to 24, that's significant money that could be saved by a practice, which could then go to, be able to employ a new member of staff, invest in other equipment, whatever it might be that your practice needs. So there's potentially huge savings that you could be make that you have no idea that you could be making without the right and proper advice. Um, it's put on there that all practices would benefit from investing in renewable technologies such as solar panels and heat pumps. So there's clearly a big drive that needs to happen to help GP practices and the primary healthcare sector decarbonise as uptake among GP practices is quite low. Um, Economy 7 smart meters is an interesting one. So you may know which tariff you're on with your energy provider, or you may not. And it seemed that a lot of practices down in Cornwall were on the wrong tariff, and they had no idea, and they were paying an extortion amount for their electricity, primarily, when they really didn't need to. So it could be as simple as just changing your supplier and saving a huge amount of money through that. Um, and then, I mean, 456 tons of carbon could be saved um, if the recommendations were implemented that were made. So there's really big scope for decarbonising through this kind of advice. So it was just great to kind of put a spotlight on CEP and the fantastic work that they've done. And we're hoping to continue that good work over here in the Midlands region. And then just a case study from us, just to, I guess, illustrate that we have done some of this work already. So this is a GP practice in Shropshire that we supported back in 2020, and we did an audit for them, and they found it really, really useful and helpful, and got a quote actually from the GP that contacted us about it. So they ended up going ahead with cavity wall insulation that they installed at their surgery, and it made a really noticeable difference in the comfort. I can let you kind of read that quote on the screen from Dr. Kinovich there. But it shows that from people taking this on, they're seeing noticeable differences in terms of their thermal comfort and the internal environment. And I know in this case study, it ultimately made more areas of the surgery usable as well. They had a particularly cold clinical room that was very uncomfortable for the nurses and patients to use, but through cavity wall insulation, it made it far more comfortable to use, which was fantastic. So just lovely to kind of see the positives and celebrating that. So that could be your practice. And that brings us to the end of our session. So managed to finish in time, which is great. 4 minutes until we get to one. And we're happy to hang on after that as well. But I know many of you will, be racing off to the next meeting or whatever it might be. But no, thank you so much for listening. I hope that this session has been informative. We'll be sending the recording round and the slides around to you as well. So if you want to catch up on it at another time, you can. And I'm going to just really open the floor for any questions, either raising your hand or putting them in the chat, and we can try and work through them. So let's have a look. Okay, I got one question from B here. In terms of primary care, how can we improve our waste streams? Only have general waste recycling, sharps, and incinerator options. Is there improvement suggestions on reducing clinical landfill waste? It's a great question. I kind of want to defer to Katrina perhaps because it's kind of not an energy related one, but more a broader sustainability question. Don't know if you have any comments on this.
Um, I tell you who we do have, and I'm very happy to know that we've got Honey and Abby on the call, who are also directors at Greener Practice. And the main thing, I mean, we want to. There is a new there are new guidance out for recycling, which we have information on our website about that. We have a group which is specifically for people who are interested in the ICB and um, their waste streams, which is all discussing primary care waste streams as well. So there's been a specific discussion on this, which I would defer to the information that's on the website. So if you have a look there in non-clinical waste. I think there was also a little comment here that the consensus, this is from Dr. Terry Kemple, who created the Green Impact for Health toolkit, about the consensus that if you've never audited your energy use, you should be able to save 10 to 20% of the cost every year. So that's really
Mm,
helpful.
that's great. Yeah, really useful
And
statistic. Yeah, thanks, Terry. Mm. Thanks for that, Katrina. Yeah, that was a
it's
helpful
okay.
one on
Sounded
there.
like a deflection, which it was, but I was just trying to focus back on the energy. But there is definitely
Yeah,
information on our website about that.
yeah, that's what I thought. I thought you'd be able to signpost to the right place. So yeah, thanks for that. Hopefully that was useful for you, B. Um, no other questions in the chat room I can see. But do shout up or put them in if you would like. But otherwise, if there's anything that comes up later, you can email us. Oh, Martin, did you want to come in there?
The old signal of just coming off mute and putting your camera on, isn't it?
Yeah, yeah,
Um,
that's it.
I, I was putting it in the chat, but it just comes up like a challenge, and it's not supposed to be. So I'm down in Cornwall, so we work with the practices, and what we found, because we're a couple of years in now, is it's really, really hard for the practices to implement the recommendations. Um, so yeah, is there a way you can help support the practices after the audit itself? I know it's a really tricky one because obviously the challenges remain with the money and the funding them, and that's
Mm,
always tricky. But sometimes it's the audit is there and the recommendations are clear, but the challenges of time remain and things like that as well. So uh, is that something you've had experience with even before
mm.
the practices?
Yes, yeah, yeah. So actually, something I didn't mention earlier is with the kind of package of support as part of the audit, we include in that like a follow-up as well, because we're aware that, sometimes just sending a big report with an overwhelming amounts of information or what can feel overwhelming can actually just be like, okay, yeah, that's great, but then it sits on a coffee table and never gets acted upon because it still feels like there's such a big next step to take. So yeah, we've built in that kind of follow up to be able to have further conversations, ask questions, digest that report together, talk through the things that they feel are accessible to them, what's going to, be in line with their budget as a practice. So it's not just kind of wishful thinking and actually feels that, okay, right, I've got, £2,000 I can spend this year on this. What can I do with 2 grand and make that, stretch as far as they can, for example. So yeah, we really want to make sure that we kind of give as much hand holding as we can post audit in that sense. So we've got that piece of a follow up, and ultimately we're here because we want to help. And if people are engaged and interested and come back with emails and questions, then we want to be there and help with that. So yeah, we'll always do our best to continue that support and give further guidance after the audit, so it doesn't just feel like you know, a steep cliff off that kind of initial spurt of information. So yeah, we're aware that it can still be challenging, even just to know how to approach a supplier or a contractor, and what are the right questions to ask. How do I know that I'm getting a good deal, or am I being ripped off? Is this the appropriate kind of insulation to use in my building? It's an old building. These kind of questions, and this is the kind of expertise that we hold. So we're more than happy to impartially kind of review a quote that like a GP's got and give them a sense check and be like, yeah, no, that's good ballpark in terms of price, or yeah, that's the appropriate kind of insulation they should be putting on your walls, or whatever it might be. So yeah, we have that expertise, and are more than happy to assist in that.
I think that's a really good thing. Even just like one scheduled check-in, I don't know when you do it,
Mm.
but a month or two down the line is just like a
Yeah,
little prompt. So I think that's a really good add-on to have.
sure. No,
Thanks, Ben.
thanks. Yeah, thanks, Martin. I appreciate the
Thanks,
question.
Martin, and thanks, Martin, and your team for everything that you did on this originally down in Cornwall, because
Mm,
it all originated down in Cornwall with the CP
mm,
and Martin's team. Um, I just everybody asks about funding. How do we get funding? There is only funding at the moment for heat pumps in the boiler replacement scheme that I was mentioned earlier. Unlike the large trusts who have, there's £1 billion going begging for various trusts to be able to make use of, because practices are not, they're small businesses in their own right. So we've been trying as Greener Practice and various other members of the primary care team to raise this as an issue with Greener NHS and beyond. Um, there may be funding packets that can be found, but I think once people can find those and share them on the Greener Practice Network, that would be very useful. Yeah, that's just something to add that we know. I think solar panels are always seen as the first line, and I think what Ben and Harry have very helpfully pointed out is that you don't need to go for the sexy, expensive stuff first. You can
mm,
actually save a lot of money
mm,
and make a big difference to
mm.
patients and staff through the boring but vital stuff that comes before getting solar panels.
Definitely, definitely, yeah. And I think something that I also didn't know as well is obviously we've kind of got them packages of support that I mentioned earlier, and do email Harry or myself if you're interested in those. But we also want to be able to kind of make this as accessible as possible. And you think, oh well, I'm not sure if I want to commit to that full package, but perhaps just want some other advice or advice on something specific. Then do get in touch, and we can work out kind of a more bespoke arrangement for you specifically. If it's just something in particular that you're wanting some guidance on, then we can do that. Um, Something thing I was going to say as well. Oh yeah, that was it. If like kind of behavior change is also something of interest to you, say for your staff, if you think actually like a big thing is actually just wanting your whole team in the practice to just be a bit more kind of energy aware and energy conscious, then we can also run kind of training sessions for staff members just to increase that general awareness, to make sure that your whole team's on the same page and knows what their individual responsibilities are. So if actually what you'd really love is for us to come in and do a session either in person at your surgery, or do an online session perhaps similar to this but specifically with your team, then also get in touch with us, and we can explore that as well with you. So yeah, if it's energy, we're here to help you. So yeah, cool. Well, I can see people kind of naturally filtering away, but I
Thanks,
mean,
Ben. Can I just make it clear that the audits are going to start in the first three ICBs that you're going to be starting with are Shropshire, Telford and Wrekin, and Derbyshire and Derby and
down in
Hereford and
Derbyshire,
Worcester.
yeah.
I've just had a little note, and Simon might have left now, but he said that there are upcoming cluster arrangements between Shropshire, Telford and Wrekin and Staffordshire and
Mm.
Stoke-on-Trent ICBs. So he was wondering whether that would mean that Staffordshire and Stoke-on-Trent might become eligible sooner. I think that's a really valid point. I wasn't aware of that, so that's something we could discuss after the
Yeah.
meeting.
Yeah, no, actually, our CEO had already come across this. She was in a meeting for social prescribers at Shropshire Council, and they were speaking about the merger between the two ICBs. So I think it makes sense that we extend the coverage. Obviously, unless you have any objections, Katrina, but I'm sure you won't say no to more
Not me.
surgeries
That would be brilliant.
benefiting.
If
So yeah,
so, wherever there's the interest, I know that you're very keen to try and do as much as possible for
yeah,
wherever you can in the Midlands. So
definitely.
yeah,
Yeah.
one day we'll do the world.
Yes, one day. Yeah, one ICB at a time.
Yeah,
One surgery at a time, little baby steps. Yeah,
baby steps.
great. Well, yeah, unless there's any other comments or questions, we can wrap it up there. Just want to check the recording and stop that one.